Well, tonight, as a measles outbreak in Ohio continues to grow, those cases are renewing the focus on vaccines and whether they should be mandatory.
All right, let's bring you up to date on where things stand right now. Columbus has 56 total cases, 54 in unvaccinated patients, 2 in partially vaccinated patients. Now, keep in mind, some of those patients are too young to even get the vaccine. We just checked in with the Richland County Health Department. It still has just 1 case, but remember, that person was at the Richland Mall last week. I spoke with the health director there Friday. She told me this.
We just want folks to be aware of a potential exposure, and the individuals who really need to worry about it the most are those who are unvaccinated for the measles.
Measles was at one point considered eliminated in the U.S. So what's changing? News 5's Morgan Trow has a closer look now and explains why some doctors blame lawmakers.
Measles, this dangerous yet preventable disease, was eliminated in the United States in the year 2000, a huge win for modern science.
I have witnessed firsthand here in this state a child dying of a vaccine preventable illness.
But there's been a resurgence, including the latest outbreak in Columbus, Ohio.
Now we have 50 of the 55 cases in the United States. How did we get here?
People not vaccinating. People decide to stop vaccinating their kids, and then the number of susceptible individuals in the population starts to go up.
Dr. Amy Edwards is a leading infectious disease specialist at University Hospital's Rainbow Babies and says measles, if it doesn't kill you, drastically alters your immune system and can cause brain damage. But it also hurts all of the other children who aren't old enough to get the vaccine or who are immunocompromised.
A child that is not vaccinated and is healthy and their immune system is intact and working fine is of no danger to anyone else.
But Streetsboro mom Amy Martinez says she isn't responsible for anyone else's kids, just her own, who are unvaccinated for all diseases. She says she doesn't want to lose her freedom to choose just because some parents may feel anxious.
Every child is entitled to an education regardless of their vaccination status.
Columbus Public Health data shows that each of the 20 hospitalized children were unvaccinated. In an update, there are 56 cases. 2 of the total cases were partially vaccinated. 12 are less than a year old, while 26 are between 1 and 2. Typically, a child gets the vaccine between 12 and 15 months. That means some of these cases could be from babies who are unvaccinated due to age or parental choice.
You don't have to vaccinate your child, but you do not have the right to force that risk onto the rest of us because of some stupid conspiracy theory that we read on the internet.
This trend isn't just gaining force online, but it's getting publicized by lawmakers at the State House, too.
So now they're magnetized.
There are numerous bills and a ballot initiative being heard to promote medical freedom in Ohio. Activists are now trying to get signatures to put an amendment on the ballot saying that it would be against state law to have any vaccine requirement in schools, hospitals, or any other public or private entity.
In a resource-rich country dies of a vaccine preventable illness. It just makes me angry.
At the Ohio State House, I'm Morgan Trow reporting.
Now, symptoms of measles appear 7 to 21 days after contact with the virus. They include high fever, cough, runny nose, and watery eyes. Now, a measles rash typically appears 3 to 5 days after initial symptoms.